everyone, welcome back to Sowkya Med Vision. Today we are going to discuss the fascia in the pectoral region. In the previous class we have dealt about muscles of pectoral region, pectoralis major, pectoralis minor, subclavius and serratus anterior. Yes, their origin and insertion, their actions with nerve supply we have completed in the previous lecture. Today we are going to discuss about the fascia in pectoral region. Yes, let's see. What is fascia? Fascia is a connective tissue. Yes, made of cartilage, which is elastic. Yes, there are different types of fascia in our body, classified under superficial fascia, deep fascia or visceral fascia. Today we are going to discuss pectoral fascia and clavipectoral fascia. So, pectoral fascia, it is a fascia presented in the anterior. It is presented in the anterior aspect of pectoralis major. Yes, pectoralis major we have discussed in the last class. And it is firmly attached, it is firmly adhered, anchored to the pectoralis major. Now what are the extensions of the pectoralis fascia? It is superiorly attached to clavicle. Yes, the pectoral fascia is superior extended to clavicle and inferiorly it is extended to fascia of anterior abdominal wall. Yes, fascia of anterior abdominal wall. And superolaterally, it is continuous with the deltoid muscles fascia. A fascia covering deltoid muscle. So, the superolaterally pectoral fascia is continuation with fascia covering deltoid muscle. And infrolaterally, it curves around. Inferolateral border of pectoralis major. Yes, inferolaterally it is continuous with the axillary fascia. Let's see in the diagram. This is the inferolateral part of the pectoral fascia. So it is a continuation of axillary fold. Yes, superiorly this is the clavicle. So this is the clavicle. Superiorly it is attached to clavicle. As I said, this fascia is firmly anchored to pectoralis major. This is the pectoralis major muscle. The fascia, pectoral fascia is firmly anchored to the pectoralis major. Yes. Now let's see clavipectoral fascia. Clavipectoral fascia. It is extended from clavicle to the pectoral region. It is a very strong fascia. It is a very strong fascial sheet. It is presented deep to clavicular head of pectoralis major. Yes, how many heads are there for pectoralis major? Let me know in the comment. So, it is presented deep to clavicular head. It is presented deep to clavicular head, which is said in the last class of pectoralis major. And it is extended vertically. It is extended vertically above to the clavicle. It is extended vertically above to the clavicle by splitting and covering the subclavius muscle. See, here it is the subclavius muscle. Our clavipectoral fascia is splitting above and covering subclavius muscle. Below it is continued as axillary fascia. This is the axillary fascia, right? So below it is continued as axillary fascia by enclosing. Below also it is splitting and enclosing pectoralis minor muscle. Yes, pectoralis minor muscle and continuation to the axillary fascia. And it is extended medially. It is medially related to ribs, right? So it is extended medially at first rib and attached to costoclavicular ligament and blend with it. Yes, it is extended up to first rib and blend with costoclavicular ligament. Laterally, it is attached to coracoid process. Coracoid process. I have explained scapula. You can watch in the video. And blends with coracoclavicular ligament. Medially, it blends with costoclavicular ligament. Laterally, it blends with coracoclavicular ligament. Let's see the structures piercing clavicular fascia. The lateral pectoral nerve, a branch of brachial plexus. Thoracoacromial artery, a major artery we are going to discuss in the further classes. and the lymphatics from the breast. Very top important topic in the breast. So lymphatics from the breast and cephalic vein in the upper limb. Yes, this is the discussion of fascia in the pectoral region. This fascia is not so important for exam, but you have to know. Yes, this is the deep discussion of pectoral fascia and the clavipectoral fascia. If you have any doubts, please comment in the comment section. If you like the video, do like and please subscribe the channel.